Stephanie Bell-Flint joins us now to talk about PET scans. If you have questions, you can email those questions or send them to the doctors at WLBT.com.
Thank you, Maggie. Joining us now is Dr. Alfred Figueroa with Baptist Cardiology. Thank you so much for joining us.
Pleasure to be here.
And tell us, first of all, what is a PET scan?
Well, it's a nuclear cardiology test, and traditionally it's been used in the oncology arena, but now it's made the leap into cardiology. And I think that the easiest way I can explain it is it's making a leap from maybe watching regular TV to watching a very pristine, nice picture on a high-definition TV. And of course, this translates into a much more accurate diagnosis for the physician and allows for less, maybe unnecessary tests to be done down the road.
So what's the difference in the PET scan and a CT scan, where you get the dye and the IV and that kind of thing?
This actually is a combined test of PET and CT technology together. But primarily, it is a nuclear scan where you use a radiopharmaceutical. In this case, it's rubidium-82, which yields, if you will, subatomic particles that goes to the heart. And the gamma camera will pick this up and allow it to measure perfusion of the heart. And it's very sensitive and a much more accurate test than what we had before. The problem with our previous scanning, nuclear scanning, is that in patients that are overweight, there was a significant problem, and in women it lends itself for artifacts, and therefore a lot of unnecessary tests were being done down the road. This is actually a very good test for the first time, that it's equally as good in men as in women, and it is also very good for obese patients.
Okay. Well, we've got someone who sent in several questions, so we'll start with the first two. How long does the PET scan take, and do you have to do anything to prepare for it?
There is an appropriate fasting state, and primarily you avoid caffeinated beverages. That's a very good question, actually, because our previous nuclear scanning took several hours. And this is a test that the patient can be in and out in 45 minutes.
Okay, here's another one. What about the cost? Will insurance pay or will Medicare pay?
Good question. Our nurses and all of the personnel in our offices do struggle a little bit with pre-certification with some of the insurances, but Medicare does pay, and yes, it is covered. I don't know the exact cost, but yes, the government and reimbursement has a lot to do with this technology having made the leap from research into clinical practice.
Okay. And that's the last one that person has sent. Remember, you can send it to the doctors at WLBT.com. So when you're doing a PET scan on a patient, what are you looking for?
We're looking primarily for blood perfusion of the heart muscle. And so we're using, if you will, a potassium analog that has to actively cross the cell membrane, and it is dependent on blood flow. A gamma camera picks this up and translates it into tomographic images that we will interpret. The better the image, the more accurate we can be with the diagnosis. And this particular test, we can diagnose coronary artery disease when it's present in greater than 90% of the cases. And when it is not present, we can exclude it in greater than 90% of the cases, making it a superior test than what we've had before.
Oh, that sounds great, and it's really not invasive, too. So.
That's right. Yeah, they will need an IV.
And that's it.
We'll need an IV, and that's it. In 45 minutes, you come in and out of the scan.
That's great. Well, Dr. Alfred Figueroa with Baptist Cardiology, as always, thank you for joining us.
My pleasure.
And for more health news, go to our website, WLBT.com, and click on Medical Matters.